Hey Doc, this is a case that you wanted to take a look at together. Um, Definitely a predictable case. Um, Invisalign or clear aligner therapy predictability. I always start with, do we have class one relationship with the molar and the canines? We do, for the most part, um, left and right. So whenever we have anterior only movements that are needed, we don't have a sagittal discrepancy. We know the predictability of the case is going to be there. The thing I always look at, especially with crowded cases, um, when we unravel everything, will there be an anterior interference? So I know you and I have talked in the past about the fallacy that clear aligner therapy causes posterior open bites. And I think this is a relevant case. I don't think it's going to be a problem. I just want to kind of share the concept because I think it's that important. For years, especially early on with Invisalign, clear aligner therapies, um, inexperienced and experienced clinicians were noticing posterior open bites after treatment, especially a case like this. And the theory was that the trays caused intrusion of the posterior teeth, and that's why you had the posterior open bite. In reality, intruding teeth, especially with a small number of trays like this, is rather difficult. There's a lot of biomechanical force needed um, to do that kind of movement. What actually was happening, and why it's relevant here, is you would have straightening of the lower teeth, and then you would have premature contact upon closure of the anterior teeth, thereby causing a relative posterior open bite. So it's not that the back teeth moved at all, it's just the front teeth are hitting sooner and the back teeth can't touch. There are patients that this causes TMD, there's other patients it causes fremitus in the anterior, but the majority of patients don't know any different, they just feel like they can't close their back teeth. The reason this is important here is the Bolton Analysis is a tool that we can use to assess whether or not that's going to be an issue or not. Because if it's an issue, then it's maybe a time that we actually do want to do IPR of the lower anterior teeth. Here we have a little bit of spacing to start with. If we go to the final, it looks like you have a really nice outcome. A little bit of overjet here. During a refinement, we may want to close this a little bit, but I like where this first ClinCheck is, in great part because it's an easy case. They got it right. More often than not, what Invisalign sends you the first time is not necessarily exactly what is needed. So the tool that we would use is over here in maybe tables, Bolton Analysis. So what this says, mandibular excess. What this means is when the teeth are straight, what's the likelihood that you're going to have excessive arch length on the lower? There's two different measurements. There's the 3 to 3 and then the 6 to 6. They're both important. In a nutshell, what it says here is you're at much higher risk for having anterior interference because of the fact that the lower arch actually has a tooth width discrepancy compared to the upper arch. The beautiful thing about ClinCheck software is we can actually see what the ending is going to look like. This Bolton Analysis was more of a tool used in the days when they had to make these measurements on models and they were trying to get a sense of where the teeth would go or where the interarch relationship would be after the teeth were aligned. So we can rely on what the ClinCheck tells us, but I think it's an important academic exercise to get a sense of what the Bolton discrepancy is. Under a millimeter, I don't think I'm going to put a whole lot of thought into it. I think you and I both agreed, just looking at the case from a 10,000 foot view, that we're going to be fine. But I think the best time to review cases is before problems happen. You probably won't have any issues. With that said, have the conversation with the patient that they're at slightly higher risk for having a posterior open bite as the anterior teeth start to resolve, in which case the solution will be IPR. And I say that because the patient's already class 1 molar, so we're not going to fix any sort of sagittal discrepancy through advanced sagittal techniques with TADs and elastics and buttons, but instead a little bit of IPR, which brings me to my final point. When we have crowded teeth like this, the interproximal bone after resolution sometimes ends up causing black triangles. So the more crowded teeth are, the more conversation you want to have with patients that they might have black triangles. There's different ways of resolving them. There's the restorative technique. There's also IPR, and then squeezing them together, which is what I think we would do here if that happened. Important point. Crowded teeth, black triangles may not exist preoperatively. You start to unravel these teeth, and basically there's less bone between the teeth. Essentially, aligning these teeth is not going to have as much interseptal bone as maybe this site here. As a result, you're more likely to have deficient tissues and aesthetic compromises. One way to resolve that is IPR. So we slenderize this tooth to then allow closer adaptation of the soft tissue and the bone between these teeth, which then causes or can cause papilla fill. Why is that relevant here? Because we might need to do IPR anyways for the Bolton discrepancy issue. So it's all kind of tied in. All I would do is I would go ahead and accept this ClinCheck, just let the patient know posterior open bite risk is there. If so, we may decide to do IPR. I would also let them know that this is likely to happen, and if it happens, there's ways for us to resolve it, but we'll make that decision depending upon the presence of a posterior open bite or not. If there's no posterior open bite, then maybe you just want to use composite to fill this in, or veneers. If there is a posterior open bite, then I would probably say IPR, close it, and improve the posterior open bite that way. So hope that makes sense. Easy case, but definitely worth having a conversation, and keep me posted.